It's your big day, the big moment of your surgery's coming up. And then the day before, you think, oh my God, what shouldn't I eat before I go under the knife? So let's talk about the 5 worst foods to eat before you go under the knife. Some of it's a little bit like who's buried in Grant's tomb. It's not rocket science, but it's just things that are unhealthy for your body. So if you think of some of the things that are the most unhealthy thing for your body and for health reasons, that's probably not going to be good to eat before surgery. But here's 5 things. Sodium, high sodium foods. So there's lots of them. Any processed food tends to have a lot of sodium, but like ramen noodles, think of all the potato chips, things like that. All those things, in addition to sodium, are just rubbish for your body. So those aren't good because sodium will suck fluid out. So the counter is that you should be drinking lots of water. And not we'll get to that doesn't mean drink like a case of Coke or a case of beer or any of those things. Water's good, but sodium actually dehydrates your body. So that's one of the things that you don't want to have happen. And as a matter of fact, as you may know, if you've had surgery, they tell you don't eat or drink after midnight, right? So stay away from sodium products, high fat foods, things like double bacon cheeseburger, refried beans topped with sauerkraut, whatever. High fat foods just aren't great health. There's not a lot. There actually is some value to fat, right? We know this, but it's not great for you, especially right before your surgery. Really spicy foods, any of these things, sriracha, jalapenos, ghost peppers, anything that can cause GE, gastroesophageal reflux, things like that are really not good to eat. Sometimes even if you're not having surgery, if you eat a lot of spicy foods, a lot of people have issues with, they call it heartburn. That's GE reflux. So you want to stay away from those things. Relatively, a day or 2 before the surgery, you should be eating, relatively bland things. Don't go out to the Mexican restaurant that you love and eat a whole bowl of the hot sauce, because that ain't going to go well. So now alcohol, that's probably one of the key things that a lot of people love, but it's not good for you because it dehydrates you. It really messes with your sleep cycle. That's probably, the biggest thing I've learned about wearing my Whoop band is what alcohol does to my sleep, and it just kills my sleep. So you want to be really well rested. Even though you're going to sleep through anesthesia, that's not really good quality sleep. So you want to rest your body because you want your body to be strong like bull, when you go to surgery. So you want your body in as tip-top shape as you can have it. So you really want to minimize alcohol. Now, that being said, you have to be a realist. It's not like most people can't have a drink, but if you have 1 beer or you have half a glass of wine. We'll talk about this here in a second, but red wine, there is some data that red wine inhibits platelets, so you probably shouldn't be drinking red wine, even though I think that data is a little bit soft. But you could have, 1 drink, it would be fine, but really probably best to totally stay away from alcohol if you can do it. And then I call it the sugar and spice foods, but anything with refined sugar, processed sugar, tons of candy, there's zero health benefit to eating a lot of candy. It's messing with your glucose levels, it messes with your homeostasis. And then the other spices are things like, say, for example, garlic. Garlic is a problem. It causes a problem with platelet aggregation, which can cause you to bleed. So you want to stay away from that. So don't go to your favorite Italian restaurant and get the bread with extra garlic topped with refried beans and have 5 martinis. It's just not going to go well for you when you go to surgery. So what do you do? So those are the 5 things not to do. What do you do? Well, just basic things, maybe relatively bland the day before, night before the surgery, but lots of water. Water is probably your best friend, because the more hydrated you are, the better shape and homeostasis your body will have during the surgery, especially getting you past that window of time when you're not supposed to be eating or drinking after midnight. Again, it's not rocket science, but it's good measure, and it's something that's good to think about and maybe even plan for if you're going to have surgery, because when your big day comes, you want to be prepared to get your best result. And that this stuff will just help you. So hopefully you find that helpful. Send us your comments to let us know if you like this, you want to hear more about things like what to eat before surgery or what not to eat, and make sure to subscribe. We'll see you next time on Hey Doc.